that they're supporting this mental health, mood tracking, even cognitive behavioral therapy for the users. In the other contexts, such as physical health, weight management, symptom checking, and all that, there are these other apps called K-Health that they provide these kind of. And also in other contexts, such as personal and professional development, like career coaching, goal setting, and all of that, a lot of people are using ChatGPT and other chatbots. And some of these, like, they're all related to well-being, but some of them are more stigmatized than the others. Career coaching is not as stigmatized as weight management or physical health. So this is another example of an app called Visa that they are nowadays providing two options for people: to have a text chat conversation with a therapist, which is the paid version, or have a text chat conversation with an AI chatbot to receive some sort of therapy. And most of the digital wellness platforms, even in telehealth apps or other programs, are now kind of focusing more on these text chat services because they are cost effective, accessible, and already embedded in these apps. So in this paper, we're kind of focusing on the main question of, like, if people have the option to choose to text chat with a human expert versus the option to text chat with an AI chatbot, which one would they choose and why? We believe that in stigmatized situations, there is this trade-off between your judgment concern and misinformation concern. Those who have been affected by stigma probably have this fear of being judged, and they may fear talking to human experts just because they don't want to get judged again, and maybe that's why they may choose AI chatbots. But we should know that human experts are more reliable sources of information, at least so far, and there's a lot of research showing that chatbots, or in general AI chatbots, are providing like some sort of hallucination, sometimes misinformation. They try to be more agreeable, and they may hide some part of information. So there is this risk of misinformation. So there is this kind of trade-off, and we're not sure whether fear of judgment can outweigh the fear of misinformation. So mainly our research questions and quick findings here. We want to see what is the effect of stigma on individuals' preferences for seeking information from AI chatbots. Do people prefer AI chatbots? So the answer is kind of. Why kind of? It's because when we try to measure stated preferences using online studies, we observe that people still prefer human, but they're less averse to AI. So there's an AI aversion kind of attitude, but it gets kind of weakened under high stigma. But when we actually ran field experiments on Facebook where people don't know they're in an experiment, the preferences flip. In high stigma, they actually prefer AI chatbots. Next, we want to see what drives these preferences, especially with the misinformation and judgment concern. When there's no stigma under normal situations, people don't have much judgment concern, but the misinformation concern is high. But when we increase the stigma level, something interesting happens. Not only their judgment concern goes up, but interestingly, their misinformation concern goes down. They no longer care about misinformation as much whenever they're experiencing some sort of stigma. And because of that, under stigma, the judgment concern goes up, the misinformation goes down, and somehow judgment concern outweigh the misinformation concern, and resulting people preferring AI chatbots more. So a quick review on how our paper is linked to the literature. There is this huge paper on AI adoption, talking about AI aversion and AI appreciation. There are different factors like algorithmic characteristics that derive people's attitude or preference towards AI or algorithms, like whether they are transparent or not. Or user characteristics, like what is their expertise level and how does that affect their preferences using algorithms. And task characteristics, like the research has shown that people are less willing to use AI chatbots when it's to do with moral decisions or subjective tasks. So our paper kind of is more related to task characteristics, like when a situation or a task is more stigmatized, how would people's preferences shift? And it is more to do with algorithm appreciation, because we see that when stigma goes out, people prefer or appreciate algorithms or AI more. To address our questions, we are designing a series of experiments, 3 online randomized controlled experiments, and finally 1 field experiment on Facebook. So to run our experiments, first we had to decide about some sort of situations or scenarios. We curated more than 15 scenarios, including context about physical health, mental health, and personal and professional development. This is an example for weight management scenario. We asked people to imagine that they suddenly gained a noticeable amount of weight in a short period of time. They're concerned and they want to know the reasons and potential solutions. And in a pre-test study, we asked participants to tell us what they think the most common stereotypes associated with this specific scenario. And there's this word cloud that you see. A lot of people kind of said like, oh, if you're gaining a lot of weight, probably you're not doing exercise, you're lazy, and so on. So the stereotype identified here is lazy. So we did this practice for all those different scenarios, and we picked the most common stereotype from what they perceive it is the stereotype there. So here's like some of the examples. We had context about weight management, addiction, daily fatigue, work motivation, stage fear, work-life balance, social etiquette, and so on. As you see, we didn't assume any stereotypes. We asked participants in a pre-test study to tell us what they think is the most negative kind of label or association. Then we wanted to design our control and treatment. Of course, we cannot compare across these contexts. Some of these contexts are more severe, some of them are health related, so you can't really compare one context like weight management with addiction. So what we did is we fixed the condition, the scenario, the context. In the control group, we just asked them to assume or basically imagine the situation. In the treatment group, not only we showed them the scenario, but we also asked them, show them this statement. Yesterday, you heard someone say this on the radio. Overweight people must be lazy and eating too much. So in the treatment group, we are trying to kind of remind them about the societal stereotypes related to that scenario. And we are comparing the control group where there is no reminder of the stigma, and the high stigma or the treatment group where it is kind of reminding about that stigma. And before moving on to our actual experiment, we wanted to see if this manipulation has been effective. And as you see, the treatment group, the red line, is above, and it was statistically significantly higher. The people reported higher perceived level of stigma. Also, I want you to pay attention that within the context, there are different levels of stigma. For example, weight management interests, and after that, work motivation. Even in a baseline group, people reported higher levels of stigma compared to maybe work-life balance or stage fear or presentation fear. Next, we moved on to actually run our first experiment, which is a within subject experiment. So we divided people to 2 groups, control group and treatment group. And within each, we asked people this question: how likely are you to have a text chat conversation to seek information about your weight gain? So for each scenario, we asked the question that scenario, and we gave them the 2 options, AI chatbot and a human expert, and we already told them what is the definition, so we tried to make them kind of comparable. Like an AI chatbot is very competent, the human expert also has the field knowledge, so they have to rate how much they are willing to seek information from either of these information sources. So the results kind of interesting. The first column, we see that in the treatment group, the high stigma group, people are less likely to seek information overall. And this is not new, it's been established in the literature. Also, we see a negative effect for source AI. So people in general, they stated that they're less likely to seek information from AI, so there is an AI aversion pattern here. Next, we try to do this interaction effect, and we see a positive effect. This is interesting because it says that even though people are averse to AI, in the treatment group, they're kind of preferring AI a little bit more. So they're less averse to AI. And we control for some variables here, like age, gender, their AI experience, their location, whether the situation, the scenario actually is relevant to them, and so on. And we see the effects kind of remain the same. There's some sort of interesting heterogeneous results. We saw that the scenarios that are inherently more stigmatized, like weight management, we see the effect is stronger for them. Also, individuals with prior AI experience, we see that the effect's kind of stronger for them. So they're kind of preferring to use AI more. We run this 2x2 experiment to kind of validate. Now we're assigning people to different groups, AI group and human group. Now they don't know which kind of other source they are comparing. So we see that the results hold. So this is kind of some sort of validation. Next, we want to know about more of the mechanism. What we see here is that we ask them about their concerns, misinformation, and judgment concern. What we see that is under stigma, people are reporting higher judgment concern, and under high stigma, they're also reporting less misinformation. So even though misinformation concern is reducing your preference for seeking information, because under high stigma, this misinformation concern in general is kind of reduced or weakened, your preference for AI is kind of going up. And we see a full mediation, meaning that your preference for seeking information from AI is fully explained by your increased judgment concern and reduced misinformation concern. Moving to our field experiment, we designed this fake company, diet solution company, and we created these ads, a 2x2 human AI, high stigma, low stigma. In the low stigma group, we just asked them, don't feel great in your body. And then we are telling them that they can get custom diet plans from expert dietitians or expert AI chatbots. In the high stigma group, we actually told them, feeling judged about your body. So we're kind of instilling this judgment feeling there. And what we see here is that in the baseline, when we say, don't feel great in your body, people are clicking more in the human ad. But the moment we ask them, like, feeling judged about your body, they are clicking more in the at the AI ad. And these, we did some statistical analysis, and these differences are significant. So, summary of results, we saw that individuals are preferring texting with AI chatbots under high stigma, and this is explained by how their judgment concerns are increased, their misinformation concern is reduced, and this kind of trade-off between these two concerns show that how people are preferring AI chatbots more and more these days as opposed to talking to human experts. And I think one of the big contributions of this study is that before we had search engines like Google's. People, whenever they felt maybe judged, they were searching, right? If they wanted some sort of accurate information. Or if they wanted some sort of emotional support, they could go to forums, right? But now AI chatbots are merging the two. They're providing some kind of information for you, which you may assume it's kind of accurate, or at least good enough for you. And it's also providing some sort of non-judgmental, emotionally supportive for you, right? So it's kind of very important for us to know that there might be a trade-off, and people may weigh one more than the other, especially under stigmatized situations. So those who are maybe designing these AI chatbots, they maybe they need to be aware of this kind of trade-off. Thank you so much for your time.
Okay, we have time for 2 minutes, a couple of short questions. Yeah.
Yeah, lovely talking. So the stigma, right? There are so many different kinds of stigmas. Very easy to poke holes, obviously, in any study that's done. So maybe there are.
Thank you for the very interesting talk. So I'm wondering, for your claims, so your outcome of interest is to seek help, seek information from either human or AI chatbot.
Yes.
Can you give us some motivation or scenarios in general that people actually do want to seek help from? Seek information from them? Because nowadays, just like you mentioned, we are all using Google for information seeking.
Like a weight management thing. Like if you gain a lot of weight, like in a short period of time, you may think, is it like hormonal problem? Is it some sort of, I don't know, kidney disease I have? So you go and actually talk to a doctor to see whether there is. So you're seeking information about what is the reason or what is the potential solutions for your situation. Or maybe you have sleep problem and you feel very unmotivated and sleepy every morning and you don't like to go to your job. Maybe you talk to a therapist and say like, okay, or maybe even a doctor to see what's the problem and how to solve it.
I see the point. I think my question is like, so maybe when I go to a human, my object is not just to seek information, but actually, for example, if I go to a doctor, I want to do tests. If I go to a psychiatrist, I want to get medication or like I want to get emotional relief. So that when I go to human, I actually ask for more compared with like AI chatbot. Is that?
So you're saying that information can have stages. Sometimes I just want to know a little bit about something, but sometimes I actually need the medication.
Yeah.
So in all our scenarios, there's no medication or diagnosis. It's more like a scenario that you're dealing with a challenging situation and you want to know just the reasons and potential solutions. It's not about you getting advice to whether you want to have a medication or not.
I see.
So it's more of like an early stage information seeking about what's happening, what's going on. That's a very good point. There is a spectrum of information that help you.
Thank you.